A patient who is in isolation needs a temperature taken several times a day. Where is the appropriate place for the thermometer to be kept? Options: at the nurse's station, on the isolation cart outside the patient room, in the dirty utility room, in the patient's room. Answer is, it is best to keep the equipment inside the room for easy access to it when needed, and also for infection control measures. The patient in isolation may be immunocompromised or have an infectious disease. Make sure that the thermometer is only on him, limits the risk of infection. Which of the following best describes how persons affected by Parkinson's disease typically walk? Long steady gaits, they shuffle their feet while taking small steps, fast movement of the feet, always need support from assistive devices. Correct answer is, they shuffle their feet while taking small steps. Typical walk of patients with Parkinson's disease is usually described as shuffling gait, which is due to the degeneration of the basal ganglia. Next question. A male patient with a right pleural effusion noted on a chest X-ray is being prepared for thoracosynthesis. The patient experiences severe dizziness when sitting upright. To provide a safe environment, the nurse assists the patients to which position for the procedure. Options are prone with the head turned toward the side supported by a pillow, Sims position with the head of the bed flat, right side lying with the head of the bed elevated 45 degree, left side lying with the head of bed elevated 45 degrees. Correct answer is, left side lying with the head of the bed elevated 45 degrees. This position helps ensure that the patient is protected from accidental puncture of the surrounding structures in the thoracic cavity. It also exposes the puncture site while helping ensure that the patient has optimal breathing for his condition. Next question. The nurse is monitoring a child with burns during treatment for burn shock. Which assessment provides the most accurate guide to determine the adequacy of fluid resuscitation? First one, skin turgor, level of edema at burn site, adequacy of capillary filling, amount of fluid tolerated in 24 hours. Answer is C. Parameters such as vital signs, especially heart rate, urinary output volume, adequacy of capillary filling, and state of sensorium determine adequacy of fluid resuscitation. Although options 1, 2 and 4 may provide some information related to fluid volume, in a burn injury, capillary filling is most accurate. The patient admitted with peripheral vascular disease or PVD asks the nurse why her legs hurt when she walks. The nurse bases a response on the knowledge that the main characteristics of PVD is decreased blood flow, increased blood flow, slow blood flow and thrombus formation. Answer is decreased blood flow. This is a characteristics of all PVD. When the demand for oxygen to the working muscles become greater than the supply, pain is the outcome. Slow blood flow throughout the circulatory system may suggest pump failure. Thrombus formation can result from stasis or damage to the intima of the vessel. A patient is scheduled to undergo right axillary to axillary artery bypass surgery. Which of the following interventions is most important for the nurse to implement in the pre-operative period? Options are assess the temperature in the affected arm, monitor the radial pulse in the affected arm, protect the extremities from cold, Avoid using the arm for venipuncture. So correct answer is, if surgery is scheduled, the nurse should avoid venipunctures in the affected extremity. The goal should be to prevent unnecessary trauma and possible infection in the affected arm. Disruptions in skin integrity and even minor skin irritation can cause the surgery to be cancelled. The nurse can continue to monitor the temperature and radial pulse in the affected arm. However, doing so it is not the priority. Keeping the patient warm is important but not at all priority. A patient with multiple sclerosis is experiencing bowel incontinence and it is starting a bowel retraining program. Which strategy is inappropriate? Eating a diet higher in fiber, setting a regular time for elimination, using an elevated toilet seat. Options: last, limiting fluid intake to 1000 ml per day. Answer is D. Limiting fluid intake is likely to aggravate rather than relieve symptoms when a bowel retraining program is being implemented. Furthermore, water imbalance as well as electrolyte imbalance tends to aggravate the signs and symptoms of MS. A diet high in fiber helps keep bowel movements regular. Setting a regular time each day for elimination helps train the body to maintain a schedule. Using an elevated toilet seats facilitate transfer of the patient from the wheelchair to the toilet or standing or sitting position. A patient who has had total laryngectomy appears withdrawn and depressed. He keeps the curtain drawn, refuses visitors, and indicates a desire to be left alone. Which nursing interventions would most likely be therapeutic for the patient? Options are: discussing his behavior with his wife to determine the cause, exploring his future plans, respecting his need for privacy, encouraging him to express his feelings non-verbally and in writing. So, the correct answer is D. The patient has undergone body changes and permanent loss of verbal communication. He may feel isolated and insecure. The nurse can encourage him to express his feelings and use this information to develop an appropriate plan of care. Discussing the patient's behavior with his wife may not reveal his feelings. Exploring future plans is not appropriate at this time because more information about the patient behavior is needed before proceeding to this level. The earliest manifestation of hepatic encephalopathy: flapping tremor, confusion, spider angioma, and fetor hepaticus. The correct answer is confusion. An elderly patient is admitted to the hospital with swollen ankles. The best way to limit edema of the feet is for the nurse to restrict fluids, apply bandages, elevate the legs, do passive range of motion exercises. Correct answer is option C, elevate the legs. Which of the following actions is the most effective measures to reduce hospital acquired infections? Double bagging of all contaminated laundry, restricting visitors of infectious patients, using disposable supplies, and correct hand washing. Answer D, correct hand washing. A patient is diagnosed with diabetic ketoacidosis. The nurse would expect the physician to prescribe regular insulin IV, NPH insulin subcutaneous, glucagon IM and mixed insulin subcutaneous. Answer A. Regular insulin. An 85-year-old man is admitted with dementia. He continuously attempts to remove his nasogastric tube. The nurse applies cloth wrist restraints as ordered. Which of the following actions by the nurse is most appropriate? Evaluates the need to restrain by observing patient's behavior once every 24 hours. Perform circulation checks to the extremities every 2 hours. Remove the restraints when the patient is sleeping. And instruct the family to limit physical contact with the patient. Answer is option D. While recovering from surgery, a patient develops deep vein thrombosis. The sign that would indicate the complication to the nurse would be intermittent claudication, pitting edema of the area, severe pain when raising the legs, localized warmth and tenderness of the site. Answer is option D. During balloon inflation of an indwelling urinary catheter, the patient complains of pain and discomfort. The nurse should continue the procedure and assure the patient, aspirate the fluid and remove the catheter, withdraw the fluid and reinsert the catheter, decrease the amount of injected fluid and secure. Correct answer is answer option C. Which of the following techniques should the nurse implement to prevent the patient's mucous membrane from drying when the oxygen flow rate is higher than 4 liters per minute? Use a non-rebreather mask. Add humidity to the delivery system. Use a high-flow oxygen delivery system. Ensure that the prongs are in the nurse correctly. So the answer is add humidity to the delivery system.